As we're sitting here today, staring at our computers on this beautiful summer afternoon, I'm sure that we can all agree on one thing, that over the past year, we spent more time on Zoom than any of us would have ever liked to or imagined. Our college classes, work meetings, concerts, and even family reunions have all taken place via video call. Although we may joke that Zoom has taken over our lives, it's also important to consider how many lives may have been saved through the use of virtual connection. As daily lives transitioned online during COVID-19, so did our healthcare system. Telehealth, or the delivery of healthcare services through online communications technology, has enabled healthcare providers to continue caring for their patients even during the international pandemic. This summer, I was mentored by Dr. Herbert Kim Lyerly from the Duke University School of Medicine. Together, we've worked to investigate how telemedicine can increase access and equity to cancer care around the world. Specifically, I studied how telemedicine can help some of the world's most vulnerable patients, children in low-income nations suffering from brain cancer. Nearly 500,000 children are diagnosed with cancer each year. However, this burden is not shared equally amongst the world's children. 75% of cancer deaths occur in low-income countries, yet these nations only hold about 5% of cancer care resources. As a result, children in these nations are half as likely to survive cancer as children in other parts of the world. Luckily, telemedicine can help to address this disparity. Patients in remote areas are typically unable to access specialists who can treat or even diagnose their cancer. Using telemedicine, however, neuro-oncologists can provide consultations, diagnoses, and treatment plans to patients regardless of physical distance. In just a few clicks, a physician from Duke Hospital, for example, can provide care to a child thousands of miles away in rural India. Tele-oncology can increase survival rates by improving diagnosis accuracy while also decreasing treatment costs. Patients will no longer need to travel long distances for care, which is especially helpful for brain tumor patients who may have neurological conditions that affect their mobility. Patients can also participate in clinical trials virtually rather than having to travel to major medical centers, which will thus increase diversity in oncology drug development. However, there are still some technical difficulties, if you will, that surround telemedicine adoption. Despite a promising increase in internet connection in developing areas, inadequate broadband access is still a major obstacle to telemedicine care. Also, reimbursement for virtual healthcare services is often unclear, especially when the patient and providers are in different countries. Cross-border licensing and malpractice policies also slow the adoption of telemedicine. Yet these obstacles are small compared to the major benefits that telemedicine can have on cancer patients. A child suffering from cancer in one part of the world deserves the same chance at survival as a child in another. Although many of us are ready to leave video calls in the past, telemedicine may impact the future of cancer care as we know it. Thank you.